Tshwane Metro has been described as a COVID-19 epicenter in the past few weeks, with COVID-19 positive infections actually rising at a very sharp rate. Well, joining me now is the health MMC from the City of Tshwane, Mr. Saki Duploy, who's actually going to elaborate a bit further on the situation here in Tshwane. Mr. Duploy, what is the situation on the ground since Tshwane has been declared a hotspot?
Yes, now we are indeed a hotspot these days, and it's hectic. There are several reasons. I think the one reason is the unexpected increase in cases. And this is something that makes it very difficult for us. I can just quote a few and then I will come to the reasons why. Just quote a few numbers to compare. A month ago in December, this week, we had 255 on average new cases per day. And over those 7 days, 1,700. Now, this very week, our daily increase is 1,600. More than 1,400 per day more. And our over the 7 days, instead of a month ago, 1,700, now we have 11,300. So this is hectic. I think one reason is our people during December, most of them went home. When the people go home, they're out of the city and they came back. Some people came back from heavily infected areas like the Eastern Cape, the Western Cape and so on. So this is one reason. The other reason, I think the festivities, the group activities, people celebrate, they don't care. I think this was really a problem. And I think this alcohol restriction is not popular, but it's timely. Because if you're under the influence, you just celebrate and you just be happy. So this is another reason why. And these people who were away for the holiday season, they are now back. So they are here and they're bringing, some of them are bringing the COVID with them. So this is why we are a hotspot.
If I may just interject the MMC, we understand as well that hospitals are actually battling, if they are not full, but they are almost full.
They are battling, they are doing what they can. Even where we are doing testing at our clinics, we battle. We are busy setting up gazebos outside so that we can handle the testing, because if you haven't tested, you can't prevent. We more from the City of Tshwane concentrate on prevention. The cities, the hospitals are part of the Gauteng government, but we really feel so sorry for the doctors and nurses that are going full out and who's got to handle this, and even people die under their hands. It's really a sad situation.
What's the update on you guys reaching out to Medicine Sans Frontieres or the Doctors Without Borders?
Yes, no, we are so happy. We've started negotiations for a memorandum of understanding quite some time ago. Now it's almost concluded. So we've agreed on 3 ways they're going to assist us. The first way is they're going to assist us to mobilize a 3rd mobile clinic. We have a vehicle available, we didn't have staff, so they will provide us with at least staff and maybe equipment. The second is, I stressed the importance of records, of stats. We are running short of staff. Some of our medical people are also on COVID now. So we need more people to capture our information, and it's very important to do the tracing of people who were found to be positive, and especially the relatives and the people they've been in contact with. So they will assist us with a few people to assist us with calling. We do this tracing and trace a person's whereabouts and the condition for at least 10 days. And then the third is they offer us some PPE, like the gazebos I spoke of, and other needs we might have for the City of Tshwane to continue doing our work.
Yes, it sounds like you're grappling with a very difficult situation. How can ordinary Tshwane residents actually assist the city in containing the situation?
It's difficult especially if we can have the services of more nurses or nursing people, not just in the clinics, but also to do administration and the tracing, because we need qualified nurses to do that. But I think the best everybody can do in the city to assist us is ensure that you stay safe. The best way to sort out this problem of the beds is make sure that you're not going to need a bed at all. So stay safe, keep safe, stay away from gatherings unnecessary. And I would also like to call upon our young people. There are so many people now in the age group 10 to 19 who are passing on It hasn't been so bad in the first wave. Now it's really serious. So even our youngsters, please do wear your masks, do what you know you should do, and then we will make it through this time.
Thank you so much. That was Tshwane MMC for Health, Mr. Saki Duploy, actually painting a picture on the ground of what's happening with the COVID-19 pandemic, since Tshwane has been singled out for being an epicenter of COVID-19. He appealed to young people to also be cautious, as now more infections are coming in where young people are being admitted, whereas previously that wasn't the case. And with that, it's back to studio.